Good afternoon, everyone. I'm going to talk about sex today. My name is Dr. Janelle Foote. I'm a urologist in Atlanta, and one of my specialties is the treatment of sexual function and dysfunction in men and women. I'm going to be using some slides from a great organization that is dedicated to understanding sexual function and dysfunction in women, called the International Society for the Study of Women's Sexual Health. There are certain factors that predispose women to being sexually healthy and predispose to sexual dysfunction. You can see on the left-hand side of the screen, Mediterranean diet, exercise and walking, emotional and physical resilience, having a normal BMI, social support, and social activity are helpful for the health of one's sexual activity. Other factors, as you can see here, are associated with dysfunction, to include smoking because it interferes with blood flow to the genitalia, depression, use of certain drugs like that are antidepressants such as the SSRIs, cardiac artery disease, inactivity, obesity, the metabolic syndrome with the association of hyperlipidemia, diabetes, sleep difficulties, and vasomotor symptoms, aka hot flashes. There are the drugs that can be associated with problems with sexual activity. These include the drugs that you see here. In addition, drugs for chemotherapy, aromatase inhibitors such as are used in the treatment of breast cancer, and other drugs of this sort can also be associated with problems with sexuality. When one looks at a class of drugs that is very commonly used for depression, the SSRI drugs, the type of problems that women have with these drugs can include diminished libido, arousal, problems with orgasm, and so forth. Because sexual side effects happen with these drugs, or can happen, I should say, some women discontinue the drugs or are less compliant than they should be, and that ultimately can interfere with their recovery from the depression. So it can be a problem. Ways to manage these types of problems include using other types of antidepressants. For example, Wellbutrin has been used to treat depression without the associated side effects. Adding sildenafil or Viagra to a woman's regimen may be helpful to counterbalance those effects. Also, using testosterone supplementation can also be helpful. There are certain other general issues that can be addressed with sexual counseling, to include educating the couple about the causes for these problems, as well as to give ways to manage these issues that don't involve the use of medication. Let's talk about pain, because pain can be a reason why you don't want to have sex, right? Well, there are specific conditions that can cause pain, certain conditions involving infection that can be managed by your medical professional, inflammatory conditions, cancers, issues involving the nervous system, trauma to the area, issues that happen as a consequence of treatment for conditions like chemotherapy or radiation, as well as hormonal deficiencies. Most of my comments today are going to be centered with hormonal deficiencies, because this is the most common complaint that women have, particularly women who are undergoing treatment for breast cancer. This is a picture of the genitalia of a woman who has such a problem. These sorts of issues can be caused by the use of hormonal contraceptives in women who are using them, but other causes, of course, include menopause, oophorectomy, as well as the treatments for breast cancer, which can affect the level of estrogen in the body. The type of concerns that women have with the use of these products interfere with the quality of life, interfering with their partner relationship, making them feel old, and negative effects on the sex life, as we've discussed. What type of problems do women complain of with the lack of estrogen? These include dryness and lack of moisture, discomfort with sexual activity, itching and a burning sensation, soreness, feeling of tightness, loss of elasticity, recurrent urinary tract infections, as well as thinning of the tissues and a tendency to have injuries to the tissues. Shortening of the vaginal vault can be appreciated upon examination by your clinician, as well as other changes in the vaginal and the vulvar tissues. So what is it that estrogen does? Estrogen can change the pH of the, rather affects the pH of the urine and of the vagina. And in doing so, if there's a lack of estrogen, the vagina becomes more alkaline. And so some of the bacteria that tend to cause infections tend to grow better under that circumstance. By replacing the estrogen, the pH returns to being acidic, and there subsequently may be less of these urinary complaints, to include urgency, frequency, burning with urination, and urinary tract infections. This is a photomicrograph showing, if you look, what is the difference between tissues that have adequate estrogen and tissues that don't, giving you a visual representation of why these issues happen. Here you can see a nice thick submucosa here with these cells. You see these little cells look like little bullseyes. Well, the clear space around these little cells has fluid in it, and this fluid is what goes to the surface and keeps the tissues moist. In addition, the nerves that are in this area here where it's lighter are cushioned from the outside by this thick submucosa. Overall, over on this side, you can see a picture of postmenopause, where this thick submucosal lining has been replaced by this very, very thin lining in these tissues. There's less cells to support the lining here, and the nerves in this layer are very close to the surface, so that the sensation is different and more acute. So, as I mentioned before, there are some things that the couple can do in sexual counseling to make these changes less problematic. But ultimately, we want to make things feel better, because who wants to have sex if things hurt, right? So what kinds of things can a woman do to alleviate the discomfort? Certainly, certain behavioral issues like stopping smoking so that the blood flow to the genitalia improves can be beneficial, and then engaging in some type of regular sexual activity to enable the woman to continue to use the organ and organs. There are also non-hormonal vaginal therapies that can be used, and we're going to be going through this a little bit later in the talk. But first, let's talk a little bit about estrogen. As we talked about before, estrogen can affect the pH of the vagina, thicken the lining of the vagina and the vulva, and increase those cells that promote health of the tissues. There are a variety of topical estrogens that can be used. Some of them, like using the tablets and the inserts, have been studied, and the amount of estrogen and other steroid metabolites that ends up in the bloodstream is essentially consistent with the amount of hormones that end up in the bloodstream of women who are postmenopausal. So that the use of these products can be considered for women with breast cancer with the advice of your clinician. Certainly, your clinician will take into account the type of breast cancer that you have, as well as where are you in your recovery period. Other products like creams have been associated with some particularly early on in the use, some estrogen in the bloodstream, and are considered to be less safe than the use of tablets and inserts. There is the very first non-estrogen product FDA approved for the use of women who have GSM or genitourinary symptoms of menopause is ospemothene. It's marketed under the name Aspina. And this is a oral estrogen antagonist. So it's not estrogen per se, and it's actually in the same category as other drugs that are used for treatment of breast cancer, like tamoxifen. Because it is of this class, it has no proliferative effect on the endometrium or the womb, and actually has an inhibitory effect on breast tissue in animal studies. Keep in mind, however, it's not been studied in women who are breast cancer survivors, which is unfortunate because depending on where you are in your breast cancer journey, your clinician may or may not feel comfortable prescribing this for you. It works, and it is a daily oral supplement. In the case of another product that is a non-estrogen product that's been helpful for the use of women with genitourinary symptoms of menopause, or GSM, there is a DHEA supplement that can be given into the vagina and it's marketed under the name Intrarosa. This product also is helpful to alleviate these symptoms. DHEA is a precursor to testosterone. Because testosterone can turn into estrogen, it's still a hormonal type substance. However, studies have been shown that shows that the serum steroid levels are well within normal postmenopausal range. So again, given your place in your breast cancer journey, you may or may not be a candidate for this product, but you can talk to your clinician about this product too, because it appears to be specific for the genitalia. Let's talk about something that's different, and that's a laser treatment for management of the changes associated with menopause involving your genitalia, and that's the use of a product that's a fractional CO2 laser. The way that this works is to apply laser energy to the vaginal tissues to encourage ingrowth of new tissues, and so fix the problem physically as opposed to using medication. This is kind of a little cartoon showing that fractionated beams of the energy penetrate areas of the tissue that creates these changes. This is a view with magnification to show you what some of these little perforations look like in the tissues. Tell patients it's like you're aerating your lawn, if you've ever had your lawn aerated, where you've got little perforations that stimulate new growth. There have been a number of studies that attest to the safety and efficacy of this therapy. This particular study is kind of interesting because they looked at initial study about how women did in terms of their relief of certain symptoms associated with the genitourinary symptoms of menopause, with women showing that they were satisfied. The majority of women were satisfied in terms of the results that they got, and certain questionnaires were given that enabled them to demonstrate their satisfaction with the therapy. This is an interesting study. It looked at comparing the benefits of the CO2 laser treatment to the use of topical estradiol, and found that the success of the CO2 laser treatment was similar to estradiol. One of the downsides of this therapy can be cost. I can say that my practice, we do bill insurance companies to make it more affordable for patients. Let's talk about the use of These other kinds of products, I promised earlier on in the talk, I talk about the use of other adjuncts to include, and today and later on, we're going to talk about lubricants, moisturizers, and vibrators. Let's talk about vibrators. Who knew? So many different types of vibrators to choose from. One of the things that makes it so easy to get these products for us and to pick something that you might like is the presence of the internet. There are different types of vibrators that can be pretty sometimes confusing. Keep in mind that these types of vibrators, the silicone, hard plastic, stainless steel, and glass, are going to be the ones you can clean with soap and water. These other sorts of vibrators, cleaning them may be a little bit problematic. Keep in mind that over half of women use vibrators. They're good for sexual satisfaction, to improve blood flow to the area, good for immune system, and good for pelvic floor strength, and to prevent spasticity and that sort of thing. Let's now talk about the use of lubricants. Keep in mind that lubricants and moisturizers are not the same thing. Lubricants are used to reduce friction versus moisturizers, which are used to maintain moisture. And lubricants can be helpful during sexual intercourse to prevent pain and to address dryness. And we've talked about how dryness can be an issue for many women. Because half of postmenopausal women have symptoms of dryness and so forth, they're used very commonly. And here's a listing of the different types of lubricants. Water is an all-purpose lubricant, can be used with everything, but the downside is that it dries out quickly. On the other hand, we're going to skip down here to silicone. Is slippery and it's long-lasting. It can be used with condoms, but not with silicone sexual aids. Keep in mind, silicone and silicone is not a good combination. The other ones in between, the use of petroleum jelly or Vaseline and other natural oils. The downside of using these products, although they may be easily available, is that you may have a higher risk of having infections with using these products. Also, if you are prone to infections like BV or yeast infections, keep in mind you want to avoid these products in your lubricants. And keep in mind that if your male partner has erectile difficulties, silicone-based lubricants can be a little bit too slippery. One other concern that you should have for those women who are using a condom is that any petroleum-based, i.e. like the use of Vaseline, can compromise the integrity of the condom. And if you're trying to get pregnant, there are specific kinds of lubricants that you want to use that will not impact the health of the sperm. There are a variety of products to choose from. Again, the internet has made that a lot easier for us. And all of these are used. Keep in mind that some of the common ones available to us, the KY and Astroglide, do contain irritants and you may be sensitive to them. So if you are, you may want to switch to something like this. Probably Good Clean Love is the one that I have the most amount of experience with. And I have a lot of patients that are very happy with that. This is kind of redundant. Let's go past the slide. Okay, let's talk about the use of moisturizers. And I told women moisturizers are like a moisturizer you use for your hands. You put that on every single day to prevent the tissues from feeling dry. Moisturizers are used for overall comfort, and those are used either every day or every other day. The bottom line is that if your tissues are dry, use the moisturizers on a regular basis. The purpose is to replace the normal vaginal secretions that those cells may not be no longer making. It binds to the vaginal tissues, but every time the cells turn over, then it goes away, and that's why you have to replace them. Almost 70% of postmenopausal women use a moisturizer. and it can be helpful for those complaints of vaginal itching, irritation, and discomfort with sex. Doesn't mean that you don't use a moisturizer when you have sex, but using a lubricant when you have sex, but using a moisturizer on a regular basis can help the lubricants work better and have you more comfortable. There are a number of them available. Replens is something that is you can usually get at most supermarkets and drugstores, and some of these other products you can get online. Now let's talk about some newer products available for the management of sexual function. There is a product called Zolbanserin or Addy. This product has been FDA approved for the use of women who are premenopausal with complaints of HSDD, and that stands for hypoactive sexual desire disorder, meaning that you're not interested in sex. So that's what this is, a product. It is in the category of SSRIs and can improve a woman's desire to have sex. So if after you've taken care of any discomfort issues, you feel that desire is still an issue, this is a product that can be used. Although it's been FDA approved for premenopausal women, studies have shown that it's helpful for postmenopausal women as well. And it's a tablet that's taken every night. It should not be taken with alcohol when you take your pill. That's probably the biggest thing that you need to know. In phase 3 trials, it is helpful in improving women's satisfying sexual events, their desire, and as well as the distress associated with the lack of desire. There are some side effects that you can see here with the dizziness, sleepiness, nausea, and fatigue being the most likely, but you can see that these are slightly increased when compared to women who had the placebo. And in regards to the alcohol, as long as you don't take alcohol when you take your medication, there should be no problem with interaction. There's another product that's more recently available called Vyleesi. Vyleesi is a product that is used for sexual desire and arousal also. It can be used, it is FDA approved for women, but sometimes men use it too. And it's been FDA approved for premenopausal women, but again, studies have shown this helpful for postmenopausal women as well. Unlike the use of the Addy I talked about earlier, this is used on demand. Like a Viagra would be used on demand when a man wants to have sex or a woman wants to have sex. This is used when you want to have sex. Unlike the last product, which is an oral drug, this is an injection and you get it in a little injector to use. It's very effective in managing sexual desire, and it's also been demonstrated to be effective in managing distress associated with the lack of desire associated with sexual activity. The biggest problem with this product is adverse events having to do with nausea and flushing. As you can see here, compared to baseline, up to 40% of women complained of nausea with the product, 20% with flushing, and 13% were complaining of injection site reactions. There are a couple of other products in the pipeline that I just wanted to mention to you. This one that combines two drugs which are actually antidepressants together to address female sexual dysfunction. Another product, again, that puts together two products that are known for treatment of depression together that are helpful for this problem, as well as these other products. You may be hearing more about these in the years to come. So in summary, I'd like to say that I'm happy to talk to you today and also answer questions at the break about sexual function and dysfunction for women. There are some adjuncts in terms of web materials that can be useful. The Susan J. Komen Society does have a section on sexuality that can be helpful and reinforces some of the things I've said today. There's also a nice review article that I found on the web from Cleveland Clinic that was published in a local paper in Cleveland that summarizes these findings. Thank you.